As a GP, I'm proud to be here in defence of the NHS today, and I share with every single person here today an unshakable belief in the founding principles of our National Health Service.
Sounds reassuring, doesn't it? Here we have the leader of the medical profession at a pro-NHS rally. What I will explain is that Dr Nagpaul and the BMA are in fact promoting exactly what the privatisation lobby need to complete the takeover of the NHS.
Values that have generated goodwill and loyalty from NHS staff, from porters, nurses or doctors who go beyond the call of duty daily in serving sick patients, whatever the pressures.
Working in the NHS allowed doctors to care for patients without having to worry about whether they can afford to pay for care. The BMA has failed to mount any effective opposition to the stealth privatisation or meaningful explanation to warn their members of the implications of each of the successive attacks on the NHS, taking us closer to the corrupt American for-profit system.
Political decisions, chronic underfunding and austerity has left the NHS in crisis, paralysed without capacity, without the staff, beds, GP surgeries or community services to meet the health needs of its citizens.
The crisis in the NHS is becoming obvious to all, yet Dr Nagpaul fails to spell out the deliberate nature of the defunding or provide any analysis of how this is designed to destroy trust in the NHS and drive out staff.
We're also under-doctored, having tens of thousands fewer doctors compared to equivalent nations.
As a BMA member, I have lost count of the number of opportunities the BMA has had to push back against the changes which have undermined autonomy and power that doctors had in the NHS to care for our patients. Control is now in the hands of a bloated and toxic corporate management structure which is required to force through the privatisation. The problem of doctor recruitment and retention are a direct result of the BMA's failure to fight for the profession and patients.
Crisis of quality and safety. Over 8 in 10 GPs say that excessive workload prevents them providing safe, quality care. This is a travesty of government policy that espouses safety as a priority in the NHS.
Patient safety? Well, let's look at the Dr Chris Day case. Dr Day raised concerns about dangerous understaffing in an intensive care unit which cares for the sickest patients in a hospital. After initial support, the BMA dropped him 5 days before a legal deadline without justification. During the junior doctor dispute last year, the BMA initially denied a problem with whistleblowing protection that the Day case had clearly identified, then misled members about their legal protection. If doctors and nurses are unable to speak up without fear of being punished in some way, patient safety is put at great risk. At a time when the BMA could have used the Day case to highlight this obstacle to patient safety, they chose instead to cook up a dirty deal with the government quango Health Education England, whose actions had created a gap in the law, removing whistleblowing protection for all junior doctors. After Dr Day's landmark victory restoring whistleblowing protection for all doctors, the BMA continued to dismiss the significance of the judgment.
The government has learnt nothing, with targets and financial balance still ruling the day in every hospital and STP, crippled by centrally driven demands of further savage cuts. Cuts which are resulting in fragmented regional access to services for patients.
The government knows exactly what it is doing. This is deliberate and premeditated. To reinforce the impression that somehow this is incompetence by government is misleading. The purpose of targets and cuts is to be able to paint the NHS as failing. A failing NHS is required as a key pillar of the propaganda against the NHS. If it was running smoothly, then how could the public be going to be persuaded that top-up health insurance and more privatisation is the answer?
And when we ask the government and the regulatory authorities to give us a hand, instead they just point the finger.
So what is the BMA, a powerful body with £100 million in the bank, doing just asking the government? The BMA leadership squandered the biggest mandate for industrial action handed to them on a plate by the junior doctors. Do they seriously think pleading with government is a better tactic? A union representing one of the most respected professions in the country has snatched defeat out of the jaws of victory.
This is leading to an exodus of doctors away from the NHS, with 1 in 3 GPs intending to quit in the next 5 years, a 13% reduction in medical student applications in the last decade, and junior doctors leaving the UK altogether, a picture replicated with a workforce crisis in nursing too. And if the government fails to increase current GDP spend on health, things will only get worse.
The medical profession has been badly let down by the BMA, who share a great deal of the responsibility for the crisis in the workforce. The privatisation onslaught has proceeded for decades and will destroy our profession and patient care. Yet there is still no effective plan to stop this from the BMA. They did take some decisive action whilst overseeing the real terms cut in pay for members. In 2015, BMA leaders more than doubled their own salaries.
The BMA is therefore calling for decisive, urgent action.
It really is a bit rich calling on others to act. When are the BMA going to take some action, instead of just warm words?
We demand from government an end to austerity cuts and give us the average European health funding and the £10 billion extra per year it represents.
Superficially, more money appears an attractive demand, but this is exactly what former health insurance man Simon Stevens, now CEO of NHS England, needs to pay for his destructive plans. More money to be diverted away from patients and to pay for Stevens' so-called sustainability and transformation plans, designed to carve up and shrink the NHS.
We must bring an end to the damaging and divisive market resulting from the Health and Social Care Act.
Marketisation of the NHS was started back in the 1990s and has increased by successive governments. The Health and Social Care Act 2012 forced all NHS services to be contracted out, opening up the oyster for private providers. Now this has been achieved, the privatisation lobby want the purchaser-provider split to go, thereby removing the legal obstacle for the formation of American-style accountable care organisations. ACOs are designed by and for the benefit of the insurance industry. It is incredible the BMA chair, attending an NHS campaigners event, manages to endorse the privatisation lobby's 2 main objectives without being challenged. More money to fund the privatisation and removal of the only legal obstacle for the insurance industry takeover of the NHS. Why has Health Campaigns Together given a platform for the privatisation lobby marketing lines? If you paid to be at the HCT conference, did you want to be persuaded of the very things that would facilitate the end of the NHS? You should be demanding answers from HCT leaders and your money back.
Thank you very much.